Welcome to the LMD Podiatry Podcast. Trust us to get back on your feet. Here's your host, Dr. Lauren DeBaccaroff.
Hello, everyone, and welcome back to the LMD Podiatry Podcast. We've got a fun one today. We're going to talk about foot health in children. And I myself, I have a 10-year-old and a 12-year-old, actually soon to be 11 and 13. And if I'm being honest with myself, I really haven't given much thought at all to their foot health. I really haven't had, thankfully, knock on wood, I haven't had any issues. Dr. Lauren, is there an age where parents should start paying closer attention to their children's foot development?
Yes, as soon as the baby comes out of the womb.
Oh, okay. I'm 12 years behind then, apparently.
So foot deformities start at a very young age, and they're mostly genetic. And there are different things that you should look for. And typically the pediatrician picks up on things when the baby is born, the first couple of months. But when a lot of the things really you start to notice it is when the baby starts walking. So when usually the average start for infants to start walking is usually between 12 to 18 to 17 months, something like that. So when they're like a year and a half old, when they start walking and they slowly gain their balance, you can kind of see what happens to their foot as it develops. And the number one thing that you should really look for is if the foot is straight or not. There are different curves to the foot that are natural, but there are significant abnormalities that can happen to a kid's foot at a very young age.
So aside from looking like aesthetically, right, at the shape of the foot, are there any other signs? Because I think most parents tend to neglect something like that, where just like me, I wouldn't really think to look at it unless I had a problem. And even if I was looking at it, I don't know, I'd be sure if it was normal or abnormal. Like, what are some more specific things you could look for? Or is there a point where you should take your child to a podiatrist just to get a checkup? Or is that something that should be looked at by your main doctor to see if you need
the pediatrician is usually the one that does the referral.
Okay.
The pediatrician will notice it. But in my experience, I don't know why a lot of pediatricians, they say that the kids will grow out of it. And it's not true. A lot of in-toeing and pigeon toeing and toe walking and flat toe.
Hold on, I want to stop you there because I want to forget. When you say toe walking, you're talking about a child that walks around on their tippy toes all the time?
Yes.
Could you piqued my interest? You piqued my interest because my son has a friend who walks around like that, and I always ask myself, like, I've never looked it up. I was just curious, what is going on there? Talk a little bit about this toe walking, because it is an interesting phenomenon.
Toe walking is very common. So
Okay.
It could be congenital, meaning there's a deeper lying issue that's causing it, or it could be idiopathic, meaning like the kids just feel like walking like that. So a lot of kids, they just like to walk on their tiptoes, and it's just, they're just, these girls that are like have ballerina feet and they like to walk on their tiptoes. And then there's these boys who, because they play and run around a lot, so they always tend to be on their tiptoes. So when they walk normally and have a normal gait pattern, you can see that they kind of favor walking on their toes. If they're constantly walking on their toes and they can't stop, then they need to go see a neurologist to see if there's something wrong with their spine or some type of something they were born with, like Charcot-Marie tooth, spina bifida, all these types of like things that are wrong with your spine as a baby can affect you and make you walk on your toes, and that's a neurological problem. So when do you know? When do you know if it needs a neurologist or not? You go to the podiatrist, and the podiatrist, like me, I watch them walk for a while. I do a very full, lengthy gait exam. I just watch the kid walk for a while. And if they're always at some point planting their heel on the floor, then I know that they just do it because they want to do it, and probably their calves are too tight. And then I fix it with a couple ways that I fix it, and it's not something more serious. if every step they take, they're always on their toes and they can't put their heel down at all, then it's time to refer to a neurologist and check them for other issues. So that's
so there's a distinction there when it comes to the toe walking between like almost doing it subconsciously without even like it's just happening versus doing it because you want to do it or you're trying to avoid some discomfort that you have, right?
Correct. Now kids, they usually don't have pain. They just walk, they're playing. It's hard to see, you know?
Just becomes natural. What you mentioned gait. I was going to ask about gait abnormalities in children. What is that term, gait? I think it's
So the word
G-A-I-T,
gait,
right?
G-A-I-T. Gait is the pattern in which you walk.
Okay.
So I do, for kids in particular and adults sometimes, I do a gait exam, and basically I just watch them walk in my hallway up and down, up and down, up and down until they get into like their natural rhythm of how they walk. And then I can see, where their foot lands, if their heel's reaching the floor, if they have an in toe, if they walk on their toes, if they're flat foot, if they're high arch. Even when I watch kids or adults walk, I could see if the issue is coming from the foot, ankle, knee, or hip. So that's kind of, the more you watch them walk, the more you can see. And then I do a biomechanical exam to see what's tight, what's excessive, what's limited, what's abnormal. It's in orthopedics, there's a bunch of angles that I learned in school. And if you don't fall within normal angles of the foot, ankle, toe, knee, et cetera, then there's something else going on, orthopedic deformities, et cetera. There are simple things that can be fixed with like change of shoes and custom orthotics. And then there's more advanced things that need surgery.
Yeah, I was gonna get to that because
pediatric orthopedist or podiatrist that's more specialized in pediatrics.
I had my own experience with flat feet. I don't remember how old I was, but I was probably, if I had to guess, approaching teenage years or maybe even in the teenage years. And I remember going and I still have flat feet. And I don't wear orthotics anymore. Aside from the obvious, right? Wearing orthotics and shoes, are there any other treatments or is there any way to kind of prevent getting flat feet in the first place? Or is that just something that is a genetic? You mentioned earlier, there's, a lot of this is a genetic component.
Flat foot is genetic, but okay. if daddy has a flat foot and then you're watching your kid kind of flat, you want to prevent your kid from having a progressive, like a flat foot that progresses over the years. And basically, as long as the kid is always in some type of orthotic as he grows up, he's going to have he or she will have a less severe flat foot. Right. So basically what the orthotic does is kind of helps mold the foot a little bit better. And your kid is probably still going to have a flat foot. It's just not going to be as bad as they age over the years.
Fascinating. I'm thinking in my head, I'm trying to figure out why it is that some folks have a genetic predisposition to these certain things like flat feet or many other different things. It's interesting to think about.
Genetics, epigenetics.
It's a whole nother conversation for a whole nother day. What would be, a piece of advice you'd give to parents out there? Maybe they just had their child, and again, just like me, this is not on their radar, right? Nobody's really thinking about their kid's foot health. What advice would you give to a parent as their child starts to grow up?
Invest in a really good pair of shoes for your kids. Don't buy the cheap stuff at Target.
But they grow out of them so quickly, Dr. Lauren. Can't I just get the cheap shoe? They'll get a new one soon enough. Come on.
No.
It's just their feet.
A good kid's shoe, ranges between $30 to $50. It's not that bad. So invest in a good shoe. And a good shoe for a kid is, I always recommend thick, like hard sole shoes and high tops. So hard sole shoe with a high top is probably the best for most kids. And if you see that they're in-toeing or tippy-toeing, have them see a podiatrist right away. If they're flat-footed, also recommend seeing some type of foot doctor or orthopedist. They need to start inserts a little early, because if you don't, how flat is your foot, Jeremy?
I mean, it's not great. I mean, if I consciously try to create some arch, I'm okay. But if I'm just standing around, yeah, they're pretty sunken down there. So,
okay, so you could have probably had, if your parents got you a new pair of orthotics every year as you grew till you reached your adult bones, till you were like, let's say 13, your foot wouldn't have done what it's doing right now.
It'll start to take shape, basically. You're like recorrecting for the issue through the management.
And infants, they're all cartilage. Most of the bones have not really developed yet. So if you could help mold the bone, like mold the ligaments and cartilage into the way you want it to be, which is not flat, then the patient, the kid, they're going to have a future of much less flat feet. It's not that they're not going to have it at all, but they won't be pancake flat like yours.
So can you look at, let's just say hypothetically, adult or a parent brought their child in at like when they started walking, and are you able to look at their feet and determine at that early age that they are predispositioned to having flat feet? And if so, have you ever done like a custom orthotic at a very, very early age, like from when they start working? Because it seems to me like the earlier you address this, like anything else, the easier it'll be to remedy the problem.
So at an early age, I'll give you an example. I took my kid to a birthday party, and it was like at a kids gym, and there was this baby that was crawling around at the kids gym, and I was like, I could not notice her feet. And basically she must have been maybe 13 months. Her feet were like C-shaped, like they were completely in-toed. And I held the baby just because someone handed me the baby, and I took a look at the feet, and I was like,
"Here, take this."
This kid, I mean, she's young. She needs serial casting. She needs to go to a pediatric orthopedist, and she needs to have weekly casting to help mold the foot into the right position, the foot and the leg. And then they were telling me that they're already seeing a doctor, and that she has a very big problem with her hip. And basically what happened was when she came out of the birth canal, her leg was kind of yanked out. So the ball the hip went out of the socket. But besides her hip issue, she also has a foot issue. That could be fixed with serial casting. The kid's still crawling, so she's not walking yet. When she starts walking, I would put her in like a brace with an orthotic. It's called an SMO, or supramalleolar orthotic. There are a lot of different devices that you could make for children to help them, come out of those horrible deformities, because they are all cartilage. So yes, if you see something a little off with your kid, someone needs to evaluate them. And I really hate when pediatricians say, oh, they're going to grow out of it, because they don't. They really don't. They don't. You have flat feet. You're a very advanced adult.
That's a kind way of putting it.
You're over the age of 40, Jeremy. How old are you?
Indeed.
No, you're in your 30s. You're 45. Okay, so you have adult feet, and they're only going to start hurting if you don't wear orthotics. So imagine how much your child could have benefited from you just progressively putting him in orthotics every year. And you could help mold the cartilage so that they don't have such severe flat feet as the years go on.
All right. Well, I may have to come back and see you again and get this checked out. And get my own situation fixed. One more thing I wanted to touch on before we wrap this up. I'm curious. I've seen before in the past that obviously different cultures have different things they do. I've seen certain cultures that will actually like intentionally restrict foot growth for certain reasons. Obviously, I would imagine that's probably not a good thing. Do you know anything about that in different cultures? I'm just curious.
So, I mean, are you talking about the foot binding in China that they?
Yeah, like I guess like in certain cultures,
like
it's attractive to have small constricted feet. I just couldn't imagine why you would want to subject yourself to that torture.
I mean, that's a cultural thing.
That's just straight cultural.
Women, they would bind women's feet because men
and their waists.
Those foot were horrible. I mean, the women had horrible foot pain, and they were walking in these little tiny shoes with no support. Yeah, they banned that. I'm pretty sure they banned foot binding in China. Right. I think it was no
good medical reason for any of that. I didn't think so. I was just curious.
But you can't. there are orthopedics and podiatrists that we do plaster casts and help remold people, like kids with really bad feet, like kids with cerebral palsy, or like if someone has a club foot. I don't know if you know what a club foot is. So a club foot is someone who their foot is like completely turned in with their hip and their knee and their ankle, and basically you slowly mold it weekly, and then it comes out and you mold it in the right position. Because if you don't do it when they're babies, when they're adults, they're going to have messed up feet, and then they need a lot of surgery, and it's not worth it.
Interesting. Okay.
It's very big surgery. So if it could be avoided, bring the kids in when they're young so we could help fix it before it gets bad.
You hear that, parents? Don't do what I did. Take notice of your children's feet from an early age and get them checked out. Ask the pediatrician. And if you notice any issues, call Dr. Lauren. She's great. She can help you. So parents out there, if you're watching this and you've had any issues with your children's feet, good, bad, indifferent, whatever it is, I want you to drop a comment below. Tell us about what happened, how you fixed it, any pieces of advice. We'd love to hear your feedback. And as always, don't forget to like and subscribe if you like this content. Everyone take care. Thank you so much for tuning in, and we will catch everyone next time on the next episode of the LMD Podiatry Podcast. Bye-bye.
Thank you for listening to the LMD Podiatry Podcast. For more information, visit lmdpodiatry.com. That's lmdpodiatry.com. Or call 954-680-7133.